We've heard from the speakers that the importance of changing the shape of care around the needs of children, young people, listening and engaging with them. We've heard that it takes a village to bring up a child. We've heard that it's not just a moral obligation, but an economic imperative to improve the life chances of children, young people. We heard that this requires systems thinking. It needs data, evidence. It needs to break down organizational silos, and sometimes going against the establishment, working towards integrated care approach for children and young people. But this can be sometimes daunting. So what at Strasys we've done is, over the years, through working with partners like Alder, developed a methodology and toolkit to help organizations, systems, and leaders to design, develop, and deliver this change for children and young people. This is very much data and evidence-led, built on experience of delivering over the last 5 years, an integrated care organization for children, young people. And as you can see, this approach is all about understanding the needs of the children, then figuring out what is the best way of meeting those needs in terms of our models of care. And how do we need to organize ourselves? How do we need to work differently? What the skills and capabilities, a lot of the stuff you heard from Dani and others, we need to develop in order to do a good job, and focusing on the right measures of success. So how do we bring all this together? So this is our way of helping, supporting various organizations, systems to do this. And we're trying to create a movement, because children can't wait for some other day in the future. We have to make an impact now. So if you're interested, please do get in touch, and we'd love to hear from you. Now, let's move on to our next section. I'd like to there's lots of questions coming through, and I'd love to start posing some questions to our panel. Dani, if I may start with you. In your overview, you talked about the need to move fast, the need to build bridges with different organizations. While you're doing the Vision 2030, what was the shift which allowed you to enable you to start breaking down the silos between organizations and within the organization?
It's a great question. The biggest shift, as far as I was concerned, was the piece work we did around the population segmentation. So with the support of the team in Strasys, we looked at all of our intelligence really differently, and we're organised as a trust and in a system around service lines. So we have sort of 62 different specialisms, for example, and that's how we're commissioned to provide services. And that's not designed around children, it's not designed around the person in the middle. But when you look at the population level segments and needs of those different cohorts, it really changes the conversation. So we had clinicians from across lots of different disciplines looking at the same cohort of kids and thinking, hang on, we're all having a lot to do with these children. Is there a different way we could organise ourselves? And it's exactly the same conversation replicated across system partners too. So the data makes all the difference, Naeem.
Brilliant. Thank you, Dani. There's a question here, which is quite an interesting one. Steve, perhaps I can pose this to you. Why is ED demand growing up to 40% when physical disease, ill health is down?
Yeah, thanks for that. Yeah, interesting question. Now, so I think that there are a number of reasons. I think the first thing is that in the old days where we had a trusted health professional in the community, i.e. a GP, you would go and see a GP if you had something that was not an accident, not an emergency. Because if you had an accident or an emergency, you go to the accident or emergency department. I think that with the challenges facing colleagues in primary care, probably also tempered with parents and families' awareness of what they might need to look out for, plus a reduced threshold for people to do watchful waiting. It's become almost a social norm that people go to the emergency department. So I suspect that if you add up the total footfall to the emergency department plus the footfall to in hours and out hours GP, there might not be an overall rise. I think probably what's happened, I was reading yesterday, is it 7 primary care practices are closing a week at the moment? It's don't quote me on that, but there are fewer opportunities for people to be seen in the community between 9 and 5, and that will probably explain some of it. So I think it's reduced availability, increased awareness, and I think why is it? Well, yeah, we've got the burden of disease is lower. I would like to see those data. I suspect that the burden of the disease is probably at least the same, if not slightly higher. But lots of things, but predominantly about the availability and accessibility of care in the community.
If I could comment on that, if I may. Certainly at Barnardo, we found that there were a lot of families in terms of family support that were presenting ED because there just wasn't anywhere for us to go. So child has a constipation, comes in, it's not a referral for emergency department, child gets sent home, constipation continues 2-3 days later, they represent. And so we were finding that a solution to that was putting family support workers in emergency departments to have those conversations. Well, it's about diet. Actually, you've got sustained cough. Is it about damping the house? So it's that kind of intervention that we're hoping will reduce the numbers. But I can understand why they've been increasing numbers because there's just nowhere else to go.
Brilliant. Thank you, Hugh, and thank you, Stephen. It goes back to the point made earlier in terms of it's not only a clinical problem, it's a community, it's about neighborhoods, it's about a collective listening to the and learning and understanding the needs of the young people. There's a lot of questions on the concept and idea of the integrated care organization for pediatrics. Dani, comes from your point in terms of the voice not getting drowned within the adult world. So Hugh, if I may come to you first, the idea of an integrated health organization for children, is that the question here specifically is what do we need to do to move towards that, make that a reality from a Barnardo's perspective?
I think there are 4 things really. I think for me it's about ensuring the voice of children and young people is heard loud and clearly, that we listen to what's being said and we implement what's being said. Second thing is, the bottom line is we've got to invest more in children. There's a heavy investment in adult. We've got to get the balance right in terms of investing in children. Third one is, for us, we think we should implement a unique child identifier. So that's about sharing information across organisations, because at the moment that's not happening, and then it slows services down. And then the fourth one for me is to give strong direction in terms of what it is that we want to achieve and what we want to do and when do you want to do it by.
Do you think, Hugh, in terms of one of the questions around what does that really mean in terms of investment? What does it mean in terms of new skills and capability, or do we have all the pieces already?
I think we have some of the pieces, but I think we need to talk to children and young people about what pieces are missing. I think you'll find that a quoted sum of investment for children and young people might be different if we spoke to children and young people themselves rather than making it. I think that's the mistake that we make. We assume there's a model, we assume this is the intervention type, and we assume this is the cost, and we have no conversation with children and young people about it.
No, brilliant. No, thank you. Moyosola, I mean, having heard the whole idea of an integrated health organization for children and putting children in the center of it, I mean, what's your view in terms of how can we make sure that the children's voice is represented in that? I mean, is it?
Yeah. An important thing, like I think it's been emphasized a lot, but listening, like, and actually following through and continuously checking with the young people, because obviously, you can listen, but in terms of implementing it, it's another story. And I think what young people want to see is not results, but at least that their ideas were heard. So it doesn't have to be implemented, or it doesn't have to be successful. It just has to be that, the service user, the professional recognizes that they said something and this is an issue. And even if their suggestion isn't possible, there are other ways around it, rather than, a young person says something, they're listened to, and then they don't get, they're not followed through from what the steps on are like.
No, brilliant. Thank you. Some really, really good points there. And I'm just there's lots of questions coming through on the idea of the integrated care. And want to pick on one more before we move on to the next topic. Dani, you mentioned earlier on in terms of the importance of lobbying and not taking a no for an answer. In terms of practically, over the next year, 2 years, what do you see happening in order to make those integrated health organizations, as known, for children into reality?
Yeah, thanks, Naeem. I mean, I think that's a huge question, and I think some of it hasn't been designed yet. So the first thing I'd say is we're trying to influence that design, and I think more people who are involved in children coming together with a really holistic voice to try and influence that design, the more the better. And we are a fairly small but pretty powerful community of people who are advocating for children when we work together, and you can see already there's a lot of links on this call of people who are working together. I think we need to do more and more of that. At the moment, the stuff that's out there in the 10-year plan, the stuff that's coming from the centre, NHS England, is quite contract oriented. It's about holding a contract across a population, essentially, for whole population outcomes. It can be complicated for children in the sense that we've just spoken about. Children live their lives in lots of different parts of the system. They're not necessarily all within health. So there might be elements of a pathway that you can pull off, or it might be that you have to look at a particular health cohort. Actually, our vision is much, much bigger than that. Our vision is that we organise ourselves fully around a population of children, and we might have multiple layers within that. You know, how do we handle children's lung health and clean air right across that whole wider, from that right through to is there a better way to deliver, I don't know, a particular secondary care service or pathway. So there could be a number of different ways of looking at IHO. But I think the fundamental thing for me is that children's outcomes are worsening. So how we tell that story in a really coherent way nationally, how we get into the right rooms to influence, how we make it so that children don't come over as a difficult one to do, because I think that's often the case, and I can see colleagues nodding on that as well. And I think there is a really important role for strategic commissioning here. And we were talking before about where have we got gaps, where haven't we got gaps? I'm not sure we've got enough capacity and capability around really brilliant strategic commissioning in the NHS. I think we've got some fantastic pockets of it. And it might be in the wrong places, but we really need those people with that liberated and future focused ambition around shifting outcomes to really bring together different cohorts of providers and partners to make change around a cohort of children.
No, thank you, Dani. There's some really important elements from both commissioning and the provision point of view as well. I'm just wondering, some of the questions popping up on my screen are related to why do children's voices get forgotten in the big world of NHS? Is it a question of timeline? Is it a question of return on investment? Is it a question about money? And I'm just looking towards you, Steve, in terms of your perspective. Yeah. Why is that?
I think that there are some fixed and firmly held misbeliefs in society. I think that there is still a lot of people, lay people, politicians, who believe that children are born healthily, so we don't need to worry about them. That children get illnesses and they grow out of them, so we don't need to worry about them. That if children do have problems, they just learn to cope with it. And we've got the enlightened people in this call. They'll be thinking, well, that's absolute rubbish. I was at a meeting in Leeds, and this was a doctor's meeting about hospital at home, which is about providing hospital at home for children. And an adult anaesthetist was there, and they stood up and they said, I know this is going to be really unpopular, but why are we bothering with children? So although to the enlightened here, it's a really good question. Why on earth don't we value children? It's because there are pervasive beliefs out there that children somehow get an epiphany when they move from childhood to adulthood, and suddenly everything that's been a problem beforehand goes away. So if you're not at school, nobody draws the line to say, well, if you're not going to school, you're not going to go to work. I think people are now getting it. I'll round up in a second. I think that now people are realizing there's been almost a 50% rise in 26 to 35-year-olds been economically inactive, mostly because of mental health, mostly what started in childhood. People are now starting, oh yeah, what happens in childhood might have something to do with adulthood. So I think it's a very simple misbelief that children somehow just get better.
And we've got to address that, Steve. Absolutely got to address that. And going
Absolutely.
back to Moyosola's point earlier on, we've got to listen, we've got to engage them. So,
Yeah.
well, on that very positive note, I'm just conscious of the time. Lots of other questions, and for those who are asking the questions, we will get back to you after the webinar as well. So apologies if you haven't got around to your questions. But can I just ask the panel to do a quick fire question, answer a particular quick question, one sentence from each speaker, please. What is the one thing you urge every leader to do when they leave this webinar? So if I start off with Moyosola.
I think one thing I would say would definitely be a commitment to actively involving young people, sharing decision making with young people, and not just any young people, all types of young people, and make sure that diversity is there.
Wonderful. Hugh? So you're in mute.
Thank you. I'd say the same. Find a meaningful way to actively engage with our children and young people.
Wonderful. Steve?
I keep it simple. I think if everybody thinks child, I'm a happy man.
Brilliant. And last but not least, Dani.
And when everybody's done all of the above and they know what matters to children and young people, do I measure it and am I improving it?
Absolutely amazing. Wonderful. Thank you all very much. We've come towards the end of the webinar. So I just want to say thank you again for all of you joining us, and special thanks to our speakers. The recording and the summary Q&A will be available soon on our webpage. Please also do subscribe to our Strasys Thinking Differently newsletter and the brilliantly titled Friday Fish and Chip weekly newsletter by my colleague, Dr. Naeem Mogul. And please do take a couple of minutes for the feedback survey. It really does help us to shape future events and learn and adapt and change. And finally, we do have our next webinar topic, which is going to be on maternity services in crisis, designing better beginnings. We hope you can all join us there. And again, finally, want to thank you all and goodbye for now.